Hey guys, Dr. Brotsky here. Welcome to week 7 of your pregnancy. If you haven't checked out my other videos for earlier weeks, make sure you do that. Right now the baby's as big as the tip of your finger, so it's getting a little bit bigger. Things you might be experiencing right now are the same first trimester symptoms I mentioned before. You might be feeling very tired, having breast tenderness, having some nausea, fatigue. You may also start to have some vomiting, which in my last video I discussed some simple things to help with that. You also might start having more headaches. Those are more common in the first trimester, so make sure you tell your doctor if you have anything like that. From a doctor's perspective, at about 7 weeks, your labs have usually come back that you had drawn at your first prenatal visit. You may just now be seeing the doctor for the first time, and that's completely normal. We also want to make sure that you're taking your prenatal vitamin. Every time you come and see your doctor, you want to leave a urine sample. We always dip that for any signs of bladder infection in the office, and also look for extra protein and glucose. Bladder infections are more common in pregnancy, and you may not have signs or symptoms, so we check for that for you at every visit. Your doctor may also want to go over some weight gain goals with you at this first visit, which is not ever fun to talk about. Just don't look at the scale, but you have to gain a little weight in pregnancy. So in general, it depends on what your body mass index is before you get pregnant that determines how much you should gain during. It's usually anywhere from 11 to about 40 pounds for a singleton, meaning one baby pregnancy. So if you have a normal BMI at the beginning of the pregnancy, we usually recommend 25 to 35 pounds of weight gain. You're also going to notice that your doctor wants to see you about every 4 weeks here in this first and second trimester, unless you're higher risk, and sometimes we'll see you more often. Your doctor may also want to do a discussion on carrier screening at this point. Along with newly pregnancy labs, this is something I talk about with my patients as well. It's always recommended to test every patient for cystic fibrosis to see if you're a carrier for that. And there are other conditions too that are genetic that you may need to be screened for as well for your baby's sake. So make sure that you're talking about those things with your doctor. As usual, you may see a baby with a heartbeat since about 6 weeks on the ultrasound, so that's always exciting. And always in the first trimester, things you need to look out for are bleeding and severe cramping. So call your doctor right away if that happens. So thanks for checking out my video today. You can always check me out at drbrotsky.com and look at the rest of my videos on my channel too.